So one of the things that's different is that the girdle, all the bones are fused together. There are 3 bones in each innominus is called, the unnamed bone, also called the os coxa. And it's a little hard to see where one bone ends and the other begins because we don't have suture lines here, which kind of makes sense. Imagine if you had suture lines, doing jumping jacks could be bad. So how do you tell where one bone ends and the other begins? This joint cavity is the acetabulum. That's where the head of the femur goes. If you draw a Y in here, it divides your body up into the 3 bones. We got a broad, flat bone here called the ilium. Ilium is actually Greek for a flat plain, a coastal plain. All right. Now in the human, it's shaped more like the continent of Africa to fit the shape of our buttocks. Cats don't have as big a butt as humans do, so it's a much more slender bone. Then we've got this L-shaped bone. That's the ischium. You're sitting on it right now. If you put your hand under your butt and you'll feel a bony bump there, that's your ischium. Wow, 2 of you actually did that. Your citium on your ischium, and this is actually the part you're feeling, your ischial tuberosity. And you've got this V-shaped bone here that goes to the front, which is your pubic bone. The right and left pubic bones are joined by fibrocartilage here. It's a cartilaginous joint. This is the pubic symphysis. In the middle here, we've got a nice big hole. And this hole doesn't do much of anything. It's called the obturator foramen. You look at something that big and you go, there's got to be something big that goes through there. In fact, some of you would probably sticking the head of the femur in here like this going, is that how it articulates? It's really just there to decrease weight. So what we will see when we do the rat dissection is a nerve comes right through here like this needle is, called the obturator nerve. And that's it. All of this is just an open space to decrease the mass of your ass. All right? So that's pretty much it. Yeah, there's subunits. Like this part of the acetabulum is the semilunar surface, the acetabular notch. But we just need to worry about ilium, ischium, pubis, pubic symphysis, obturator foramen, and acetabulum. Oh, and one little thing here. The articular surface for the sacrum. See how it looks like a human ear again? That's why it's also called auriculum. All right, so the femur. Looks a bit like the humerus, but a couple of things you can tell initially. No supracondylar foramen or crest. The neck is much better pronounced than it is in the humerus. So here we have our head and our neck. We have an elevation here and an elevation here, one larger than the other, but they're not nice and rounded like the tubercles. So instead, this is the greater trochanter and the lesser trochanter. Now on the cat, between the greater and lesser trochanter, we've got an elevation, intertrochanteric crest. We got a depression in here, intertrochanteric fossa, and a hole in the head called fovea capitis. Fovea means pit. As we're coming down now, this whole area here, particularly in humans, is a roughened triangle for our gluteal muscles to attach to. We have it here, it's just not nearly as well defined. And this is again the gluteal tuberosity. And here on the posterior surface, we have a linear elevation, the linea aspera, the brief line. Okay? Then we get to the distal epiphysis, and much like we saw with the humerus, we have condyles. One lining up with the head would be medial condyle, lateral condyle. Elevation, medial epicondyle. Elevation, lateral epicondyle. Right? You're used to that. But we do have a few extra things here as well. This is where the kneecap sits. So this is the patellar surface. In fact, here is our patella. It sits right in there. It comes to a point. That point is called the apex of the patella. On the back side, we have a roughened surface here for a muscle to attach to. That muscle is called the popliteal, so this is the popliteal surface. If you extend out your leg, you feel a ridge of muscle behind your knee. That's your popliteus. And then we got a gap here between the 2 condyles. This is called the intercondylar notch. So you got to be careful. If I tag one of these 2 areas, you could confuse them. This is where reading helps. If I want the popliteal surface, I'll probably say, name this surface. If I want the intercondylar notch, I'll probably say something like, name this notch. Yes?
Is the apex of the patella pointing distally across?
Points down. Yeah, so it's going to point distally. Same thing with us. Ours is shaped more like an arrowhead. In fact, with the human, because of the way we walk, you can actually tell from the back side by the differences for the 2 condyles, right versus left.
Good question, Ron.
Shane, are you okay there?
Got lost.
All right, here's the tibia. Tibia and fibula, of course, are paired limb bones, just like you saw at the radius and ulna, but this is pretty easy to see because it looks like the letter T. The big thing here for orientation is this structure here. This is the the medial malleolus. I always remember it as malleolus because it's flat like it's hit with a mallet. If you look at your ankle, this part of your ankle here is your medial malleolus. So since this is going along the midline, this would be a lefty. We have our tibial tuberosity right there, which again you can feel right below your knee, that bump. And you can feel this linear elevation, which is the anterior crest of the tibia. This is where the patellar tendon attaches to. Even though it's really a ligament, we call it a tendon. And so medial condyle, lateral condyle. A little fun fact that won't be on your exam, will be on yours. This elevation between the two condyles is the intercondylar eminence. That's where the cruciate ligament's attached to. So when you're watching the season opener football this weekend and people are tearing cruciate ligaments, there it is. And they cross, that's why it's called cruciform. All right, now our fibula. This is a hard bone to tell right from left on. And it's a tiny little bone because it doesn't bear weight. And it's really one of the toughest ones to tell right from left on. So even the two epiphyses are hard to tell apart. But look for your little flattened malleolus here. That's the lateral malleolus. Here is the proximal epiphysis. It has a little spike-like process. That's the styloid right there. Because again, this is not a weight-bearing bone. So this is going to sit under the tibia like this. And so the styloid process allows a ligament to anchor the two together. All right, so how do you tell right from left on this one? You'll notice that on the malleolus there's a groove. Right behind it there, that's for the peroneal tendon. It's called the peroneal groove. If you feel your own lateral malleolus, behind it you can feel what feels like rubber bands, which are the tendons of these strap-like muscles on your shin called your peroneal muscles. And so since those are behind your lateral malleolus, then this groove is to the rear. That tells you whether this is left or right. Okay? Now, just like we saw at the radius and ulna, both of these bones will have a linear elevation for the interosseous membrane to hold the two together. Interosseous margin, or border. Notice I didn't say crest or ridge. I won't take off of that on the exam, but with the radius and ulna, it was ridges, tibia and fibula margin, because the gap is not as great here. We don't need as strong of an anchoring point. It's also why you don't have as much mobility between your tibia and fibula as you do between your radius and ulna. All right, then we get to the hard part, the foot.